What is the most complex organ in the human body? It's not the heart, nor the liver, but the brain. But have you ever wondered about the health of this vital organ? Indeed, the brain, with its billions of neurons and intricate networks, is the command center for our thoughts, feelings, memories, and so much more. Yet it's not just about how well this organ functions physically, but also about its mental state. This is where the concept of mental health comes into play. Mental health, a phrase we hear so often, but what does it truly mean? It's more than just the absence of mental disorders or disabilities. It's about how we think, feel, and behave. It's about our ability to handle stress, relate to others, and make decisions. It's about our psychological and emotional well-being. Now, why is mental health so important? Well, it influences practically every aspect of our lives, from how we perceive ourselves and the world around us to how we interact with others. It affects our productivity at work, our relationships, even our physical health. Yet, despite its importance, mental health often takes a back seat when it comes to healthcare. Many of us pay attention to our physical health, but overlook our mental well-being. This oversight can lead to serious consequences. Consider this. 1 in every 4 people in the world will be affected by a mental or neurological disorder at some point in their lives. That's nearly 2 billion people worldwide. And these are just the reported cases. Many more go undiagnosed and untreated due to stigma, lack of awareness, or lack of access to mental health services. So let's bring mental health into the spotlight. It's not something to be ashamed of or ignored. It's a crucial part of our overall health and well-being. Just like physical health, mental health too needs attention. It's time to delve deeper into this unseen battle. Mental health is more than just the absence of mental disorders. It is a state of well-being. Let's dive a bit deeper into what that really means. Mental health is a broad term encompassing our emotional, psychological, and social well-being. It is the canvas on which the colors of our daily lives are painted. It influences how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. At its core, mental health is about balance. Balance between work and play, rest and activity, even the balance between what we give to others and what we take for ourselves. It's about feeling grounded, capable, and resilient in the face of life's inevitable challenges. As humans, we are complex beings, and our mental health is no different. It's not a static state, but rather a dynamic scale, constantly fluctuating with our experiences, environment, and even the time of day. It is not a destination, but a journey. And like any journey, there will be ups and downs. It's also important to remember that mental health is not a solitary journey. It's interwoven with our physical health, with one often influencing the other. They are two sides of the same health coin, and we need to care for both to truly thrive. Moreover, mental health isn't just an individual issue. It's a societal one too. It influences our communities, our workplaces, our schools, and our homes. It's a thread that ties us all together, and yet it's uniquely personal. So when we talk about mental health, we are talking about the health of our thoughts, our emotions, our relationships, and our society. It's about the quality of every aspect of our lives. In a world where we are often judged by our physical appearances, it's easy to forget about the importance of mental health. But remember, our minds are just as significant as our bodies, if not more so. After all, it's our minds that make each of us unique, shaping our perceptions, our experiences, and ultimately, our reality. Understanding mental health is the first step towards acknowledging its importance. Let's continue this journey of understanding together. Mental health issues are not one-size-fits-all. They come in many forms and affect people in different ways. With a plethora of conditions under the umbrella of mental health issues, understanding them can seem like a daunting task. But let's break it down. Depression, often misrepresented as merely feeling sad, is a debilitating condition that affects a person's ability to function normally. It's characterized by persistent feelings of sadness, hopelessness, and a lack of interest in activities once enjoyed. On the other hand, anxiety disorders, which include panic disorder, social anxiety disorder, and generalized anxiety disorder, are characterized by excessive worry and fear. These conditions often cause physical symptoms like rapid heart rate, sweating, and trembling. Bipolar disorder is another type of mental health issue, characterized by dramatic shifts in mood, energy, and activity levels. Individuals with bipolar disorder experience episodes of manic highs and depressive lows that can last for weeks or even months. Schizophrenia, a severe mental disorder, affects a person's ability to think, feel, and behave clearly. Hallucinations, delusions, and thought disorders are common symptoms of schizophrenia. And then we have conditions like post-traumatic stress disorder, obsessive-compulsive disorder, and eating disorders, each unique in their manifestation, yet sharing the common thread of significantly impacting a person's daily life. It's important to note that these are just some of the many mental health issues that people face. Each disorder has a unique set of symptoms, and their severity can vary greatly from person to person. For instance, one individual with depression might experience mild symptoms that they can manage with lifestyle changes and therapy, while another person might have severe symptoms that require medication and intensive treatment. Mental health issues are complex and multifaceted, and understanding them requires compassion, patience, and a willingness to learn. It's vital to remember that mental health issues are not a sign of weakness or a character flaw. They are serious health conditions that require professional treatment and care. Recognizing the different types of mental health issues is crucial for early intervention. With the right knowledge and understanding, we can all play a part in supporting those who are fighting these unseen battles. How can you identify if someone is struggling with a mental health issue? It's not always as clear as a physical ailment. In this complex tapestry of life, our mental health is an integral thread that weaves together our thoughts, emotions, and behaviors. But sometimes, this thread can become frayed, leading to mental health issues that may not be as visible as physical ones. Identifying these issues is the first step towards improving mental well-being. So, how can we spot these subtle signs? There are several indicators that might suggest someone is dealing with a mental health issue. The first is a change in behavior. This could be anything from a shift in eating or sleeping patterns to a sudden lack of interest in activities they used to enjoy. For instance, a friend who was once the life of the party might start withdrawing from social events, or a colleague who was always punctual might start coming in late or missing work altogether. Another sign to look out for is a change in mood. While it's natural for our moods to fluctuate, sudden or extreme changes can be a red flag. Someone might swing from feeling high on life one day to being deeply despondent the next. They might also exhibit feelings of hopelessness, worthlessness, or guilt, which can all be signs of conditions like depression or anxiety disorders. Personal care is another facet of our lives that can be impacted by mental health issues. If someone starts neglecting their personal hygiene, or if they lose interest in their appearance, it could be a sign that they're struggling. Remember, these changes are often gradual, so it's essential to take note of any differences, no matter how small. Social activities, too, can provide clues about a person's mental health. People grappling with mental health issues might start avoiding social interactions or struggle with maintaining relationships. They might become isolated, preferring their own company over others. This can be particularly concerning, as social connections are vital for our mental well-being. But remember, identifying these signs is just the first step. Mental health issues are complex and can manifest differently in different people. It's not about labeling someone or jumping to conclusions. It's about fostering an environment of understanding and support where people feel safe to share their struggles and seek help. And if you identify these signs in yourself, take it seriously. Reach out to a mental health professional who can provide guidance and support. Self-care is not selfish. It's essential. In the end, it's about compassion, empathy, and understanding. It's about realizing that mental health issues are as real as any physical aility, and they deserve the same care, attention, and treatment. Early identification of mental health issues can lead to effective treatment and a better quality of life. Mental health issues are not a life sentence. They can be managed and treated effectively. In this journey of understanding mental health, we've come a long way. We've explored what mental health is, identified different types, and learned how to spot the signs. Now we're at a crucial juncture where we discuss how to deal with these issues. Let's start with therapy. Therapy, or psychotherapy, is a broad term used to describe a variety of treatment techniques that aim to instill positive attitudes and feelings to encourage healthier behaviors. Cognitive behavioral therapy, or CBT, is one such technique that focuses on altering negative thought patterns. It encourages individuals to challenge their thoughts and replace them with healthier alternatives. Then there's medication. While it might not be the solution for everyone, it can be a powerful tool when used appropriately. Antidepressants, anti-anxiety medications, mood stabilizers, and antipsychotics are just a few examples. Medication can help manage the symptoms, making it easier for individuals to participate in therapy and engage in daily activities. But remember, medication is not a one-size-fits-all solution. The right medication, dosage, and plan should be personalized to the individual's needs, and this should always be done under the guidance of a healthcare provider. Next up, lifestyle changes. These might seem small, but they can have a significant impact. Regular exercise, a balanced diet, adequate sleep, and reduced caffeine and alcohol intake can all contribute to better mental health. Mindfulness and stress management techniques, such as meditation and yoga, can also play a significant role. Last, but definitely not least, is social support. The power of connection should never be underestimated. Support from loved ones, friends, or support groups can provide a sense of belonging, reduce isolation, and help individuals navigate their mental health journey. Of course, dealing with mental health issues is not a linear process. It's complex and unique to each individual. It's okay to try different approaches, to stumble and get back up. The most crucial part is to keep going, to keep seeking the right help and support. Remember, mental health issues are not character flaws or signs of weakness. They are legitimate health issues that deserve attention, care, and treatment. As we continue to break down the stigma surrounding mental health, we must acknowledge that seeking help is not a sign of weakness, but a step towards wellness. So, let this be a reminder for all of us. Whether you're a healthcare professional, a loved one of someone dealing with mental health issues, or you yourself are on this journey, it's okay to seek help. It's okay to reach out. You're not alone in this. Seeking help is not a sign of weakness, but a step towards wellness. Mental health is an integral part of our overall well-being. Reflecting on our journey, we've delved into the unseen battles many face daily, the silent struggles hidden behind smiles. We've defined what mental health is and how it's as crucial as physical health. We've unraveled the truth that mental health isn't merely the absence of mental illness, but a state of complete emotional, psychological, and social well-being. We've explored various types of mental health issues, from anxiety disorders and depression to more complex conditions like schizophrenia and bipolar disorder. We've seen that these illnesses aren't selective. They can touch anyone, regardless of age, race, or social status. They are not a sign of weakness or a character flaw. They are health issues, plain and simple, and they deserve our understanding, not our judgment. Identification is the first step towards understanding and addressing these issues. Recognizing the signs, whether subtle or obvious, is crucial. It's about noticing changes in behavior, mood, or social interactions. It's about being aware, not just of our own mental health, but also of those around us. We've also discussed how to deal with mental health issues, seeking professional help, employing coping strategies, and supporting each other. We've stressed the importance of destigmatizing mental health, because stigma breeds silence, and silence can be deadly. The numbers speak volumes. Globally, nearly 1 in 4 people will be affected by a mental or neurological disorder at some point in their lives. That's almost 25% of all humans. These aren't just statistics, they are real people with real stories. In closing, let's remember that mental health matters. It matters to the individual struggling, to their loved ones, and to society as a whole. It's a complex, multifaceted issue that requires our collective effort to address. Remember, it's okay to not be okay. Seek help, support others, and let's make mental health a priority, not a stigma. Let's brave this journey together towards a world where mental health is recognized, understood, and compassionately addressed. Knowledge is power, but sharing knowledge is even more powerful. If you've made it this far, we hope you've learned something new about mental health. But don't keep this knowledge to yourself. Share this video with your friends, family, and social networks. You never know who might benefit from it. Maybe it's a friend who's been feeling down lately, a family member who's been acting differently, or a coworker who's been struggling to keep up at work. By sharing this video, you could help them understand what they're going through and encourage them to seek help. You could also help others become more aware of mental health issues, break down the stigma, and create a more understanding and supportive environment. Remember, mental health is a community issue. It affects us all, directly or indirectly. By sharing this video, you're not just spreading information, you're potentially helping someone in need. Let's make mental health a priority, not a stigma. Please share with everyone.